Do you know that you can't just snap out of it when you're anxious? Do you also know that treatment for anxiety is not only possible, it can also be done in a short amount of time? In this video, I'm gonna help you debunk 10 myths about anxiety that are just not true. Hi everyone, I'm Dr. Margaret Lee, clinical psychologist in California. So, if you're struggling with anxiety, what are 10 myths about anxiety that are just simply not true? Myth number 1. Some people are just born worrywart and can't be treated. That is just not true. Treatment for anxiety is highly effective even for the ones with high genetic components. And the most documented effective treatment is what we call the cognitive behavioral therapy model. In a similar study, clients that receive CBT treatments show significant reduction of symptoms just within 3 months. Myth number 2. If I just avoid my thought, I'll get better. Wrong again. Study shows that actually suppressing your thoughts makes it even harder for you to get over your anxiety. One great example is that if I ask you to don't think about the elephant, don't think about that pink elephant dancing, what's in your mind right now? Most likely a pink elephant dancing. So our work with you is actually help you to reduce any avoidance or suppression so that we can actually work on your anxiety together. Myth number 3. Anxiety is not common. Something must be wrong with me. About 19.1% of American adults struggle with anxiety in any given year. That is about 1/5 of the general population. Think about it, right? Is that common? If there are 5 people in the room, one of them are struggling with anxiety. And an estimate of about 31.1% of adults struggle anxiety once in their lifetime, at least once in their lifetime. And again, that's about nearly 1/3 of the general population. But yet, with this high rate of anxiety, only 36.9% of adults actually seek treatment in their lifetime. Number 4, an anxiety attack or panic attack can make you lose control or pass out. So fainting or passing out usually occurs when your blood pressure drops. And actually in anxiety or panicky situation, your blood pressure actually rises. So you're not gonna pass out. It's uncomfortable, that is. So in my sessions, I actually help my client understand the fight or flight mode, which is, back in the old days when a caveman sees a bear, a caveman is gonna run. But nowadays we don't have bear running around on the street anymore. But then we have other anxiety provoking situations such as interviews or just sometimes talking to new people, right? And those new situations would provoke the same response that as if you're seeing a bear. So part of our job is actually learning to discriminate what is actual harm versus what is more of the precaution that our body is trying to protect us for the perceived danger. So your body knows that you are actually physically safe in future panicky situation. And some other important component of anxiety treatment involve understanding your pattern, right? Are you having a dysregulating alarm system? Or can we actually tune your body to respond to the actual alarm and not the forced alarm? Number 5, People with anxiety should just avoid those situations or have their family or friend come with them if they're anxious. Not true again. Well, simply you can't just avoid all situations, right? If you want a good quality of life, it's so hard to avoid all anxiety-provoking situations. And in the long run, avoiding those situations would actually make you more anxious next time you get into similar situation, right? Your body is gonna say something like, well, last time you already ran away, so that means it's not safe. Why would I want to confront it again this time? So next time when similar situation come around, your body is gonna just want to run. So instead of avoiding those anxiety-provoking situations, we therapists are here to help you to expose to those situations gradually so that you can slowly develop coping and be able to encounter those situations head-on with skills to manage your anxiety. Number 6. Maybe if I just smoke a little bit or I drink a little bit, then I won't be anxious again. Well, drinking or smoking might help you to reduce your anxiety at the moment, but in the long run, it's not really addressing the underlying concern, so your anxiety actually never gone away. So the best way is actually to learn how to cope with it, then you don't have to rely on smoking or drinking. Number 7, you should just carry a paper bag around in case of hyperventilation. So carrying a paper bag around is actually what we call safety behavior. Safety behavior is actually based on fear. Fear that there's something bad is gonna happen and that you have a contingency plan. But any safety behavior like carrying a paper bag around or washing hands to avoid germs actually reinforce your fear and anxiety in the long run. Number 8, anxiety will just go away if I can just wait it out. The average person actually wait 10 years before seeking treatment for anxiety, and during this 10 years nothing is changing. You're still with your same pattern. And furthermore, about 60% of people with anxiety actually struggle with depression as well. So why would you want to wait? Just address it head on. Number 9, people can just snap out of it if they want to. So for people that don't struggle with anxiety disorder, it's really hard for them to imagine that it's so hard to meet new people or go to new places. It's not like you don't want to, it provoke a lot of body response that make it really difficult for you to attend those situations. And some people just don't understand the mechanism behind that. So rather than trying to tackle it by yourself, you should really work with a professional to help you overcome your fear to actually addressing that underlying concern. Number 10, treatment for anxiety will take forever, maybe years. With the CBT model, it will only take about few sessions to maybe few months to address your concern. The fact is, treatment for anxiety is highly effective and can be done in such a short amount of time. And in these few sessions, you're gonna learn tools. You're gonna learn about your pattern, your body, and how to work with your body so that not everything becomes a false alarm for you. And you will actually use your anxiety to help you make informed decisions. So that's it from me. 10 myths about anxiety that are simply not true. If you have other questions about anxiety, or if you've heard other rumors about anxiety and not sure if it's true, comment below so that we can all address them together. I hope you really enjoyed this video, and if you've learned something new from this video, give me a thumbs up. This channel is all about empowering you to gain more insight on psychology and create a life with more inner peace and emotional freedom. More videos like this every Wednesday. Be sure to hit subscribe, and I'll see you next Wednesday, same place, same time. Thank you so much for watching. Take care.